Hey, good afternoon, everybody. It's Chris McCoy. I'm here joined again with Dr. Bunio from the Cherokee Indian Hospital. Dr. Bunio, how have you been?
I'm been well. Thank you, Chris.
Good, good. We've had, tragically, some news on the boundary this week. We had our first COVID-19, related death. I had some just general questions. You know, with the pandemic, has it affected any of the staffing levels at any way?
It has. There are times where we have to send staff home for prolonged periods of time. We've had, when this all started, people were nervous, and so they weren't coming up to the hospital, and so we actually had to furlough some people.
Okay.
We're getting to where we're reopening services now, but we want to do it in a safe way.
Right.
So people who've been waiting to maybe get some things taken care of that aren't urgent.
Right.
We're going to open things up a little bit, but again, we want to make sure we do it very safely. The virus is still here, so we're kind of have to change the way we do a lot of stuff.
Gotcha. Do we have any patients currently at the hospital on ventilators, for instance, or for COVID-related illnesses at this time?
We do not. We typically refer those patients to some of the bigger hospitals in the area. Okay. We do not have an ICU. We do not have ventilators. So we send them to places where we can sort of concentrate those patients, and that way those patients can be taken care of by staff that have that expertise of doing it all the time.
Gotcha. And the final question I had, and this is just some stuff we picked up right before we come on the air, it had to do with the rate of recovery, and I think it's in relationship to, if you're diagnosed with COVID, what kind of recovery period are you seeing on average? And I know each case varies.
Right. So for a person who's otherwise pretty healthy with a normal immune system, we believe that they'll be not contagious and recovered after 10 days.
Okay.
They can feel a whole lot better quicker than that. But the 10 days is the isolation period that the CDC recommends.
Okay.
If they are having symptoms longer, though, they're going to have to wait it out a little bit longer. And certainly some people who have, if their immune system is not real strong, they may have to wait for even longer, up to a month, sometimes longer, before they can safely go back out.
And so today, I know a lot of our discussion is going to be regarding folks coming back to work, contact tracing. As we see new cases happening here on the boundary and around us, there's a lot more emphasis now, I think, on contact tracing and finding out how does that work? What's the philosophy behind some of it? And and some of the public had general concerns, I guess, about what to do if they work in and around areas that may have folks that are coming into contact with COVID. Whether it be directly, like the person directly has it, or they've been a contact of someone that has it and they're working with them and around them. So how does that kind of work, and what are we saying to those numbers and dates and policies? So we'll speak a little bit to that, and we've got a lot of our questions built around that. I like your red tie.
Oh, thank you.
Is it your favorite? Do you have a favorite tie?
Not really, no. No.
Just it's a tie.
Yeah,
just kind of throw it on. Yeah. I also see you got some goodies, and I guess we'll talk about that as we get further into it.
I do, yeah.
Cool. So is wearing a mask harmful to the mask wearer? We'll start off there.
Right. So so that's a really good question. There's been some stuff in social media that are saying, well, these masks are not healthy for the person wearing them.
Okay.
I wanted to respond to that, and I brought along some masks, in particular because of the chief's executive order. Right. We know that's going into effect on Friday, which I support, by the way.
Okay, good.
What about masks again? So to answer the question, we do not believe that wearing masks is harmful to the mask wearer at all, with one exception.
Okay.
If you're wearing a mask and you think that protects you totally, and you might go and do something where you're not following the social distancing, that could hurt you.
Okay.
So the one time that assuming that you have a normal lungs and you can breathe just fine. Wearing a mask is not harmful. There's a couple of things that went out on social media that suggested that the mask would hold in carbon dioxide, and that might hurt you. This is not true.
Okay.
Surgeons wear these masks for hours and hours and hours on end, And there was actually a study that looked at someone wearing a mask for 4 hours, the amount of carbon dioxide did not.
That recirculates behind the mask.
It's not harmful.
Okay.
Also, that the mask might grow some mildew. Well, this is why we ask you to wash them. I mean, first of all, that's not going to happen anytime soon. I did bring some masks along just to kind of go over the different types. So,
okay.
So I'm wearing a cloth mask. This is the one that we recommend most people use because they're easy to get a hold of these days, and you can wash them.
Right.
This is what we call an ear loop mask. It's got these. This is one for children because it's got the nice little.
I was actually hoping you might give that to me after the show because I like it.
I will give it to you. And so this one has a little metal piece at the top, so you can mold it around your nose. Piece. In general, for all of these, the closer it fits to your face and the less circulation that gets around the mask, the better.
Gotcha.
We want the air to go through the fabric.
Okay.
So this one goes around the ears. It's what we sometimes refer to as a procedure mask. And this one's pretty good. It's a step up from the cloth mask.
Okay, cool.
Next, we have the surgical mask. Again, it's got this metal piece here. This one has ties. These also come with ear loops. These are made with different layers that are intended to trap more of those droplets
inside
that escape. Yeah, so this is more effective.
And I do real quick want to interject.
Yep.
The masks, and when we're talking about wearing the mask, again, it's not primarily for your protection.
That's
although
right.
It has the added benefit of protecting you somewhat.
That's right.
We don't know that they're doing math. There's some kind of science in that. But it's to protect the people outside of the mask.
Right.
Correct. So you're expelling your droplets?
Yep.
Okay.
That's right. So that is true. Now, the CDC has been hinting that they're going to release something this week about an analysis. They and from what I'm hearing, they still feel like what you said is true, that we wear masks to protect other people.
Right.
But they're hinting that they may have found some guidance that it also protects the wearer.
And I'm sure there's got to be somewhat protection. It's just the purpose is not primarily there.
Right.
It's an added benefit to wear a mask that you protect yourself, but you're protecting other people. That's why we encourage other people to wear their masks.
Right.
Yes, we're doing our part in wearing ours, but we need you out there in the public to wear yours as well because that protects me. Yeah. I'm doing my part to help you. You help me.
Yeah, none of this is 100%. Right. We're just trying to put the odds in your favor.
Right.
So you don't get someone else sick. Now, the last two masks here, this is one that I had in my basement from Lowe's. It is technically an N95 mask, but it's got this little valve on the front.
Okay.
So this will allow air to escape from the front. So this kind of defeats the purpose of you wearing a mask to protect other people.
Okay.
But when you breathe in, that valve closes, and then all the air has to go through the fabric.
Okay.
This is only effective if everybody else around you is wearing one.
Okay.
Otherwise, it's going to protect you, but not anybody around you.
So this has a little more self-protection probably because of the design. It keeps out the small pieces when you're...
Yes, and then this isn't like a hospital N95, but it's similar. You don't have the valve in front.
Okay.
And basically, this really fits tightly to your face. When you're wearing one of these, and we like to reserve these for healthcare workers.
Gotcha.
When you breathe in, the mask kind of sucks back on your face, it seals, and all the air has to go through these layers and layers of fabric.
Gotcha.
So this one will actually protect someone from what we call aerosols, which are those really, really tiny droplets that stay out in the air longer.
These are harder to get your hands on, I'm sure.
They are.
Are they recyclable? Can you reuse? Are they reusable?
You can to a certain extent. We do reuse them. There are some systems out there that use a variety of things, ultraviolet light or hydrogen peroxide. Not the liquid, but sort of a mist of hydrogen peroxide where they can sterilize them. But after so many sterilizations, they start to lose their filtration ability. So the N95s themselves really should be reserved for the healthcare workers.
Right.
I mean, if you've got one in your basement that you got from Lowe's, when you were sanding something,
right.
I mean, I think that's fine.
Okay.
But yeah, right now we're recommending, of course, the cloth masks for the average person out in public.
Good. I have the one with the ventilator on the front there, whatever that is.
Yeah.
I like to sound like. Have you seen Batman?
Yeah.
I like to sound like Bane and like ride around and order fast food with it.
That's exactly what I could see you doing, Chris.
That's exactly what I do. I really freak people out with it. It's a really cool mask. But you're right. It's not doing its purpose to protect others.
Right.
And it's only kind of helping me a little bit. But I think you're right with the better options there to kind of help do both, serve the best of both worlds.
Yeah.
Okay, good. So that answers that question. So for folks out there, if you have questions about masks, if you have questions about guidelines, OSHA rules, the studies, you can call the hotline. Dr. Bunio will have some information out as soon as they release information that we can help you with through the hotline to help you understand why you should wear a mask, why it's helpful and beneficial and not really harmful.
Yeah.
And to help us kind of curb that messaging and make sure that folks know that they are good for us to wear.
Yeah.
Something is better than nothing.
Yeah, and remember, we're trying to get to that 80% mark.
That's it.
If we can get 80% of the people to wear a mask, when they're out, particularly inside public spaces,
right,
we can lower the spread of the virus. That's all we want to do.
That's right.
We want to protect each other.
That's right. Okay, so what is considered, now let's get more into now, I guess, some of the things we've been facing this week. What is considered direct contact?
So the CDC defines like a close contact as being within 6 feet of someone for 15 minutes or more.
Okay.
Without any protective,
okay,
masking or equipment. So, if you find out or you think you might have been near somebody,
okay,
let's say they didn't even know they had the virus, and you find out either through our contact tracing team or through the grapevine, hey, let's call him Bob. Bob had the coronavirus and you were around him.
Right.
We typically go back about 48 hours, to try to find out who we need to call.
Okay.
And say, listen.
And I know that's one of the questions coming up, so we'll dive deeper into that. But so a direct contact, the difference with a direct contact and a close contact is the direct contact is?
Well, yeah, I think we kind of use those terms interchangeably. So we're going to call everybody who they can call us, or we're going to call them. If Bob gives us a list of people he was around, then we're going to call them and we're going to say, listen, how close were you to Bob and for how long and where was it? And then we will say, yeah, you should get tested.
Right.
Obviously, if people are nervous, we don't mind testing people, even if you didn't get within 6 feet.
Gotcha. Okay, so that's direct contact.
Yep.
Now let's talk about, I work with someone who tested positive but have not been contacted as a direct contact. Should I be tested and should I be concerned?
You should be tested. And so we rely on the person that that has the positive test. And our memories are, if you ask me, everybody that I came around in the last 48 hours, I probably wouldn't remember. Now, I wear a mask all the time, so I don't, with the exception of my wife, I haven't been around anybody without my mask on. But
I don't have friends, and so that's
that's also the same. That's also a good strategy.
Yeah, I don't have any friends.
Yep. So we rely on the person who tested positive to tell us where they've been and who they've been around.
Okay.
Sometimes that list is incomplete. So if you think you've been in contact, give us a call. Call the hotline. Come up. Get tested. And should you be concerned? Well, if you're feeling well, obviously I understand you're going to be concerned, but just get tested. We'll advise you what you need to do.
Good deal.
For sure.
Good deal. And so with that, how long do I wait to get tested after exposure to a positive person?
Okay. So it takes about 5 days on average to develop symptoms, but it can be up to 14 days, 2 to 14 days. We recommend generally, and this has changed, is that after you have been exposed to a person who's COVID positive, that you be tested around day 8.
Okay.
And the reason for that is at day 8, we get the highest number of tests that will accurately pick up the virus.
Okay.
That your body needs time. Well, if the virus is in you, the virus needs time to replicate, to reproduce, if you will, and get into your nose where we're going to put our swab.
Gotcha.
So we want to make sure that if we test you, we get an accurate test. Now, the only change to that is if you're already feeling sick. Okay. Then we should go ahead and test you right away because, we don't often have an exposure to a person at one particular point in time.
Okay.
Sometimes we do, but a lot of times you've been around this person for, a week or so.
Right.
So you might have actually caught the virus, already 8 days ago.
And that's part of the follow-up I think I have to that is we mentioned the number 8 days. Is it 8 days from when they tested positive and they got the results, or is it 8 days from when you might have been around them?
It's 8 days from your last exposure contact. So not from the test positive 8 days later, but when you were near them and had that exposure. Yeah.
So if you were around them 4 days before they got their test results, you need to wait 4 more days, on average about 4 more days if you get the best.
So if you think about it, it's from the day that you might have got the virus from them.
That's a simple way to
You need 8 more days. Unless you're already starting to feel sick, then you can be tested earlier.
Gotcha.
Yep.
And so what do I do during this time to protect my family, while I'm kind of in this area?
Yeah. Well, unfortunately, you may need to isolate yourself from the rest of your family.
Right.
So there's guidance about how to do that if you're COVID positive.
Right.
If you're just worried that you might be, then maybe sleeping in a different room, having a bathroom to yourself, if that's possible. It's really difficult.
But it's a really good opportunity if you've got like that cousin that always likes to borrow your car to just be like, you can't
borrow
my car this week. I'm kind of waiting.
Or you can put a tent up in the backyard or something. I don't know. I mean, but
to that, that might be a reality.
So basically, you want to practice all the things that we ask people to do all the time, which is wear a mask, social distancing, good hand hygiene, but kind of, kick it up a notch, if you can, just to protect your family.
Okay. So self-quarantine a little bit on that while you're just kind of waiting.
Yep.
Very good. How far back does contact tracing go? And I just asked, is it from the test date, the result date? Is it the last contact? So we kind of answered that.
Yeah, it's typically we start with the test date and then we'll go back 48 hours.
Okay.
But if the person tells us they've been sick for a week, we're going to go back a little bit further.
Okay.
Remember, we think that someone is, on average, someone who has a normal immune system is going to be contagious for 10 days.
Right.
It depends on when that person came to get tested in that 10-day period. So it's kind of like a little bit of detective work that our contact tracing team has to do to figure out. But in general, it's 48 hours back from the test date.
Okay.
And then, of course, since the test usually takes a couple of days to come back, if that person's been quarantining like we just talked about, hopefully they don't have any more contacts. So, but if they do, we'll also look at contacts, between the test and when we get the result back.
Gotcha. Very good.
Yeah.
Do you get notified faster if you're positive for COVID than if you're negative?
Yeah, you do. As soon as you're positive, that gets reported, and we contact our public health colleagues. And our goal is to tell everybody who has a positive test as soon as possible.
Okay, so let's walk through a hypothetical that I get a test result this morning. What happens? Does the contact tracing team immediately reach out to me and start to pull information?
They will. They'll also be notifying tribal public health and human services, and because there's overlap, we also have to notify the county health departments.
Okay.
So you may actually get several calls.
Oh, wow.
And there are times where we can't reach people, and our public health nurses will just go out into the community and find people, which is really awesome.
Oh, that is great.
Now, if you're negative, we have a lot of negative tests. You can see from that report, we're in the over 4,000 tests that we've done. So we do like to call people and let them know that their tests are negative. We just don't do that, at 3 a.m.
Right.
We and most of those calls are happening, Monday to Friday.
Right.
When we have the staff.
Are you getting results all weekend? Is that a thing too? Do you do it on Saturday and Sunday?
We tend to get some results back over the weekend. Yeah, it depends on the lab. It's Quest is the lab we send them to. It just depends when they run them and they report them back to our lab. But anytime we get a positive, it gets reported to people, even if it's on the weekend.
Right. And I know, I don't know how far we can get into it on the air here, but we'd mentioned before coming on air the possibility of being able to do test analysis here.
Yeah, we're doing our best. I mean, there are systems that can run the test. We actually have one. People refer to that as the rapid test.
Okay.
But we found that particular brand to be kind of unreliable.
Okay.
So we use it when we have to and we got no other choice. But there's another system that we're trying to get, and believe me, everybody in the country is trying to get them.
I got you.
But it's the same system that Mission uses, Pardee and Advent. And this can run a test usually in about 30 minutes or so.
Wow, that'd be incredible.
The challenge with those is we can't, even Mission can't reliably get what we call the reagents, which is the chemicals that we need to run the test. So even they have to limit them. But if we can get one of those in Cherokee, we can get our turnaround time down significantly.
Oh, that'd be awesome.
Yeah,
cool.
It's what we want to do.
Let's keep our fingers crossed that we can work into that. That'd be a really neat and advantageous piece for us to have.
Yep.
Will they call 24/7 with results? And I guess we just answered that one, really.
They will, yeah.
Okay.
Oops.
Oh, final one here. For contact tracing, they say to wait 8 days until you get tested. Is it 8 days from the positive person's test or 8 days from when contact tracing calls you?
It is 8 days from the day that you might have been exposed.
So it's neither of those.
You're right, yeah. So, I mean, let's say you were at the tattoo parlor or something.
I mean, you looked at my arm.
Or let's say church.
Okay. That's
so you were at church and, you hadn't been for, a couple of months. And, so it was just one day.
Okay.
So you're going to take that as the day. And you're going to count 8 days from that. Right.
8 days.
If it turns out it's somebody, that you work with all the time, you're going to generally go from, your last day of contact.
Okay.
And hopefully as soon as they know they're positive, you're going
to be on that.
Yeah.
Okay.
So it's a little trickier if you're around somebody all the time.
Right. Dr. Bunio, with folks back at work now, what's the ultimate messaging that we can give folks in the workforce and in the community as far as how do we mitigate and stay safe in this time?
It just goes back to what we've been saying the whole time. It's, wear your mask,
right.
Social distancing, and good hand hygiene, wash your hands. The masks are, don't take the place of social distancing. You should be, staying away from people when you can. But if you can't, the mask is the next best thing. So do that. We're not out of the woods. All you have to do is turn on the news and see what's happening in Florida and Arizona. Right. And I think it is really difficult. I mean, we do not want to have to shut things down again. Nobody does. Wearing your mask will help to keep things open and help to keep, businesses get back on their feet. So it's good for the economy as well.
Good. Well, thanks for bringing all these cool props on with you today. It's good to see all these different masks.
I'm gonna let you keep this one, by the way. There you go.
I need to sanitize it, though.
Yeah, absolutely, because I touched it.
No, it's cool. So folks out there in the community, continue to wear your masks. We're going to continue to share information as it comes to us in relations to the technology that we have, statistics that we're finding and things like that. They're still kind of generating those, and so we'll bring it to you as we get it. If you have any more questions out there in the public, please reach out to us on Facebook and pose those questions. We'd be happy to talk about it here on the show. Every Wednesday we're getting together for now. Things are starting to kind of quiet down. We don't have quite as much information or question coming out of the public, but we will be here for at least another week or so to kind of answer these questions as we move forward. We'll see you again very soon. Thank you again, Dr. Bunio.
Thank you, Chris.
Dada Daga Hunyu.